Elvis, and good afternoon, everyone. Yes, India is a very big country, and I'm very happy to say that I don't live in New Delhi. Doesn't mean that I don't suffer from the experiences of horrible air. And in the spirit of continuing with stories, my story is from a small industrial township where I grew up, where I spent most of my formative years of life, surrounded by coal mines and power plants. I will not even mention the name of that city because that doesn't feature in any of these records of poor air quality data. We only look at New Delhi and we don't. I mean, that's another inequity that we see within the country, that it's a national capital region that gets a lot of spotlight, and the poorer remote areas which have more toxic, more lethal air quality are often missed in the story. So my own journey of my father used to work at the steel plant, and every evening he would come home covered in coal dust. So my experience of pollution, I've seen pollution enter my life, my home, and shape my own experience of what it means to live with pollution. I'm a campaigner. I'm a campaigner with Global Climate and Health Alliance. And one thing very early on I learned about being a campaigner is to repeat. So what you'll see in the next few slides is a lot of repetitions of what you've heard, but repetition is also a very good way of remembering things. We saw maps, just in terms of the scale of problem that we are seeing. In 2023, out of the 100 worst polluted cities in the world, 99 were in Asia and mostly South Asia and Southeast Asia. So in terms of the look at the right side of the map, that's where the concentration of problem is. And that's true. I mean, and majority of that source of that problem comes from our dependence on fossil fuels. South Asia and Southeast Asia's dependence on fossil fuel for electricity, for transport, is over 75%. So we see an obvious link. But that's not the full part of the story that I'm going to tell you today. Out of the 99 worst polluted cities in South Asia and Southeast Asia, India has a notorious record of hosting 83 of those cities. So we have more than, I think we have a lot of authority in talking about pollutions and solutions, because that's the reality that we are living in. We saw this image in the morning, and I want to again repeat this image. Imagine living in a place or in a region where a simple act of breathing, which is so essential for life, kills you. And again, this is an image borrowed from a lung surgeon in New Delhi. And I'm trying to now channel his way of explaining this image. So on your left-hand side is a lung, a healthy pink lung. That's what we ought to have. What you have on the extreme right-hand side is a lung of a 55-year-old person who has been smoking for over 30 years. And what you see in the middle is an image of a lung of a 14-year boy living in New Delhi. And the unfortunate reality of this image and this exposure is that this impact is irreversible. And that's what we are seeing in our daily lives. Not all of us have the privilege to go look inside our bodies to see the impact, but this is what our doctors are seeing in their clinics. And if this is not the reason to fight for clean air, then I don't think there is any better reason. We have talked about it. Again, I'm repeating this. I feel, and it's important to remember that air pollution and climate crisis are two sides of the same coin. They have the same sources of problem, whether it's fossil fuels, industry, or transport. And a lot of the solutions that we will be talking about, solutions for cleaning up the air are also climate solutions. And that's, again, an added incentive to ensure that if we are working on clean air, we are also working on climate action. And that's a very important argument to present to our policymakers for them to understand that the systemic nature of problem that we see, if we make intervention in and put our resources in cleaning up the air, we are also acting on the climate crisis. Now, again, I showed you the lung image, but this was an experiment because many people, despite living in poor air quality, don't understand how bad the problem is. And one of the ways to make this a reality for people is to visualize the problem. And we did this experiment in New Delhi, outside a hospital, where we set up huge billboards with HEPA filters with fans behind them to suck air, mimic the behavior of lungs. And the fans were sucking air. That's the image on top left. I'm going to mix up my left and right, so just follow the cue. The white lungs was the first day of the installation where the minister came and cut the ribbon and presented the billboard. On day 10, this was the reality. So breathing toxic air for 10 days converted that billboard with white HEPA filters to a color that I don't even think it can be called black, because there are probably different shades of black that we're experiencing. And this was a very interesting experiment because for the first time it made the problem of air pollution so visible and real to many people who always suffered from the adverse impacts, but didn't know or didn't understand how deeply it was affecting them and affecting their children and how deeply it was impacting them. I mean, we hear a lot about, and it's a fact that air pollution kills 7 million people annually, premature deaths. But what is also important is not just the death, the loss of quality of life, the hospital admissions, absenteeism from schools, absenteeism from work. And all of that has a severe economic burden that further impoverishes an already marginalized, already impoverished population. And I think when we are talking to policymakers, it's important to make the case of saving lives, but it's also important along with that, talk about quality of life and saving money. Because at this point, the global data from 2019, a World Bank study said that found that air pollution cost our economy $8.1 trillion US. That's almost 6% of global GDP was lost because of air pollution. Now, I want to specifically talk about this one policy brief, a roadmap that we prepared earlier this year. And the reason why I want to talk about that is just to give you a little bit of context. One, yes, South Asia and Southeast Asia are among the worst polluted geographies in the world. But again, it will be very unfair and single-dimensional approach to say, oh, they are the polluted regions and we need to find solutions from elsewhere to replicate in those geographies. What we want, what our experience has been, yes, there are problems, but there are also incredible policy interventions that are being put in place in these regions to tackle that problem. And there are lessons to be learned from there, lessons that can be replicated elsewhere, especially in low and middle income settings, and perhaps also in the global north. So we really wanted to challenge this narrative that this is a place of problem and solutions have to come from outside. There are solutions in place, perhaps they need to be amplified. And the opportunity to do so was earlier this year with the World Health Organization's second global conference on air pollution, which was held in Colombia. And in the lead up to that, our objective was twofold. Showcase solutions particularly led by health ministries. And this is where something I think we need to be very, very intentional and cognizant. Right now, in majority of the places outside the health spaces where we are talking about air pollution is still seen as an environmental problem. And not only is it seen as an environmental problem with the Environment Ministry intervening, it's also seen as a technical problem. That means you fix the tailpipes, you fix the smokestacks, and probably the problem will go away. These are important solutions, no doubt about it. And I'm in no way saying that that's not needed. But what is also needed, if we don't see air pollution as a health problem, the health implications, the health care that is required because of people who are sick from air pollution, those measures will never be factored in. We heard in the morning about amazing progress that China has made in improving air qualities, which is fantastic, and we need that. However, what we have not heard, which I hear often from doctors and medical practitioners, that China is among the topmost countries dealing with a lung cancer epidemic. Now, the air quality has improved, rightfully so, very important, but the impact, the health impact of that poor air quality continues and requires a long-term vision and long-term intervention. And if the health sector, the health ministry, and the health community is not at the policy table thinking of the solutions in that way, we are missing out on care that we can design for people, and there is a cost to it that people pay from their pocket, and nobody is held accountable. So from that perspective, we started looking at where are good, important health measures being put in place, in which geographies, what can we learn from them? So that's how we sort of landed up in putting together this roadmap. And what this roadmap does, it takes what we have identified are 5 important interventions from a health point of view, and we have collected case studies of good practices around those interventions, and then looked at what are the replicability of those case studies in other settings. So among the 5 interventions, and we talked about it in the previous session, health impact assessments become very important to understand what is the disease burden, what kind of pollutants are driving which kind of diseases, and where are the opportunities to leverage cross-sectoral collaboration in tackling some of those the response, and also where is the technology. So in this segment, we documented a case study from Trinidad and Tobago, where the Pan American Health Organization is using a WHO tool called AirQ+. And that is a tool that helps them understand what is the disease burden from PM 2.5 exposure, how many deaths, how many cases of disability, and helps them shape where the interventions need to be done and how the health community needs to be prepared. So that was an example from a health impact assessment point of view. Then we looked at cases where and another intervention that health ministries can bring in is by conducting comprehensive health systems assessment, including vulnerability assessments. Now, we hear vulnerability assessments a lot from an extreme weather preparation point of view. From an air pollution point of view, when patients are affected because of poor air quality and they come to their hospitals, they expect a certain kind of care. Are the systems even prepared to do that? Do they have the capacity to do that? And if they don't, it's the responsibility of the healthcare system to prepare, and that means that there has to be a budgetary allocation. That means that there has to be a certain kind of certain number of medicines that have to be allocated, and all of that means cost. And somebody has to make those financial decisions of what costs where needs to be put in. So we looked at some cases from central India, some of the worst polluted, again, geographies. These are places with coal mines and power plants, and we saw what an incredible change when, and this is a case study from the government, the Department of Health in central India, where they are preparing themselves in anticipation of poor air quality days, what kind of medical needs are required to treat patients. And the upgradation of health infrastructure has a very interesting ripple effect in terms of how community understood air pollution and organized itself to demand for better policies. So it's not a one-way street where patients come to the hospital and get treated, but the effect of that was that when patients felt better at their treatment centers and got relief, they also were empowered to question why they were falling sick in the first place. So it had a very interesting effect in terms of mobilizing communities. Similarly, and again, I'm told that I have very little time, but strengthening health systems, and there is a very interesting case study that we documented, a couple of case studies from the UK, where health professionals are increasingly looking at local air quality data in treating their patients, and how effective that measure was, not just in kind of addressing the diverse kind of problems patients were facing, but also helping patients organize better and demand for better policies. And then, interestingly, and this was very interesting discovery for us. Southeast Asian, the Association for Southeast Asian Nations in the ASEAN countries are actually, not even probably, are the first group of countries to have a transboundary agreement on air pollution management. We heard about transboundary problems. We heard about how air pollution sees no barriers. But in terms of solutions, what was very, very interesting to discover that if there is any kind of regional cooperation between countries, respecting each country's sovereignty, to a commitment to tackle the air pollution problem, it was in ASEAN in Southeast Asia. And there's a lot to learn from this example, because not only it's regional cooperation, it's also interdepartmental cooperation. And this structure, this framework of regional cooperation has also trickled down in individual countries to model the same kind of cross-sectoral collaboration approach to tackle air pollution crisis. In Singapore, there is a air pollution, the haze action plan has 38 government departments led by the health ministry to tackle issues of haze whenever that crisis happens. In Malaysia, in the Philippines, there is a environment and a health committees that sits together along with, in consultation with the transportation department, to particularly look at air pollution from transportation sources. And when we are talking about this serious problem of air pollution, we must remember that it's not just environment department, it's not just health department, it requires a cross-sectoral collaboration, because the nature of the problem demands different agencies to come together to figure out what would work best in their local settings. And then, last but not the least, this is something I referred in my intervention in the last session, involving communities, frontline community members, local authorities, local agencies, people, young people, school children, in deciding what kind of policy intervention from a health point of view is needed in certain geographies is absolutely essential. It's essential because it helps maintain accountability. It's also essential because it will help you understand that maybe the solutions that is needed in New Delhi, for example, will not work in where I come from. And that kind of granularity, that kind of approach, in localized approach, is absolutely essential. While the crisis is severe, the crisis requires a very specific, tailored response to different geographies. It's not one size that fits all. And to document that, we have a case study from South Africa where in the 2022 victory in the deadly air case was a great example of how community, after being completely disillusioned by lack of government response, went to the court and won an order which basically determined and made it very clear that the right to clean air is the fundamental right to health, and the government has an obligation to protect its people. And now, since the order, Now, the health ministry has come forward and is working with the community to decide where are the monitoring systems that need to be set up, who are the most vulnerable in the community and what are their challenges and how that can be met. And that's a great example of community involvement in decision making. Yeah, just the last bit. One more minute. My apologies. I think just to recap, what we are attempting to do is, again, the problem is severe, the solutions exist, and the solutions are actually coming from places where the problem is severe. And we really need to be cognizant of this fact, that there are no such thing as somebody from outside will come and fix the problem. We definitely need solidarity. We definitely need the funding. We definitely need to hold the polluters and the governments accountable. But we must also be aware and be cognizant that many of these polluted places are also leading with solutions, and solutions that are beneficial for health, led by health departments, and establishes the importance of including health agencies in the decision making. Please, let's not expect health agencies to come and clean up the mess after the pollution has happened. There is a role for health agencies to intervene right and address the root causes and also design strategies to protect people. That was pretty much it. Thank you so much.